This medicine is used to treat bacterial ear infections, including outer ear infections, also known as swimmer's ear, in both children and adults. It contains a combination of ciprofloxacin, which is an antibiotic, and hydrocortisone, which is an anti-inflammatory corticosteroid. These ear drops work by stopping the growth of bacteria and reducing ear swelling and discomfort. It's important to note that this medication only treats bacterial ear infections and won't work for other types of ear infections. Using antibiotics unnecessarily or too often can make them less effective. The recommended daily dosage and optimal timing for taking this medication will vary depending on the specific condition being treated, so it's best to follow the instructions provided by your doctor. To use Cipro HC suspension, drops as prescribed by your doctor, typically twice a day, about 12 hours apart. Before using the medication, make sure your ear canal is clean and dry. To ensure the correct amount of medication is given and to avoid touching the ear with the dropper, have someone else give you the drops if possible. To reduce the risk of dizziness, warm the container in your hand for a few minutes. To apply the ear drops, wash your hands first and avoid touching the dropper tip or letting it touch your ear or any surface. Shake the container well before using. Lie on your side with the treated ear facing up. Hold the dropper directly over the ear and place the recommended number of drops into the ear canal. For adults, hold the earlobe up and back to help the drops roll in. For children, hold the earlobe down and back. Keep the head tilted with the treated ear upward for about 1 minute, or use a soft cotton plug if directed. Repeat the same steps for the other ear if directed. Do not rinse the dropper and replace the cap after use. Use this medication regularly at the same times each day to get the most benefit from it. Continue using it for the full time prescribed, even if your symptoms improve. Stopping the medication too early may cause the infection to return. Contact your doctor if your condition lasts or gets worse after 7 days of treatment. Report any fluid in the ear after treatment is completed. Do not use in the eye. If you experience a headache while using Cipro HC suspension, drops, inform your doctor or pharmacist if the symptoms persist or worsen. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Using this medication for a prolonged period or repeatedly may lead to a new fungal ear infection. Do not use this medication for longer than prescribed and consult your doctor if you notice any new or worsening symptoms. While a severe allergic reaction to this drug is rare, seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned, contact your doctor or pharmacist. For medical advice about side effects in the U.S., call your doctor or report them to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, call your doctor or report side effects to Health Canada at 1-866-234-2345. Before using Cipro HC suspension, drops, make sure to inform your doctor or pharmacist if you have any allergies to quinolone antibiotics or corticosteroids. Also, let them know about your medical history, especially if you have a hole in your eardrum or an ear infection caused by a virus. If you are pregnant, only use this medication if it is absolutely necessary and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication as it may pass into breast milk. It's important to be aware of potential drug interactions when using Cipro HC suspension, drops. This medication may interact with other drugs, affecting how they work and increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medications. This will help to ensure the safe and effective use of Cipro HC suspension, drops. If someone takes too much of Cipro HC suspension, drops and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. This medication can be harmful if swallowed, so it's important to take the proper precautions. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition. Make sure to throw away any unused medication after your treatment is completed. Don't use it later for another infection unless your doctor instructs you to do so. Also, it's important to keep the infected ears clean and dry. Try to avoid getting the infected ears wet when bathing, and avoid swimming unless your doctor tells you it's okay. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When storing Cipro HC suspension, drops, make sure to keep it at room temperature and away from light. It's important not to freeze it and to keep it out of reach of children and pets. When you no longer need this medication or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.